Hi. So now we're going to get into tonsil and adenoidectomy instruments. These instruments are going to be mainly used to remove bad tonsils and adenoids out of individuals, i.e. the tonsil and adenoid instrument set. So the first instrument we're going to talk about are your dull towel clamps. A lot of times we're going to use this particular instrument to help secure drapes, believe it or not. We usually place a towel over the head or some type of thing over the head. So we'll need something dull to kind of keep it in place. We also have a towel clamp sharp in the set, and that's what it's for. It's towel clamp sharp. Anything that the surgeon may need throughout the case where they'll say, hey, give me this real quick, you have it there. The next instrument that we tend to have in all of our instrument sets is our Kelly hemostat curved, which you guys learned about in the last instrument preview, okay? As well as a straight. Alice. A lot of times we can use Alice to grasp our tonsils if we don't have anything else. So we'll grab the tonsil with the Alice if we're going to use a Bovie, suction Bovie, or if we're going to use a snare, as well as the next instrument, which is the Schnitt tonsil clamp. For the Schnitt tonsil clamp, however, a lot of times we're going to put an actual tonsil ball on the Schnitt tonsil clamp, and we use it in two ways. We use it to either kind of dap blood, or we'll put it in place to kind of suck up any blood that may be happening in the particular procedure. Needle driver. I've had some surgeons that actually will sew the mucosa closed with the needle driver. So we have a needle driver in this particular set as well, which is really important. The next instrument that you are going to see is the Heard elevator. The Heard elevator is going to be used to kind of move the adenoids and different things out of the way so that we can get visualization. And it's exactly that. It's elevating things to help us to be able to get into the area where we can operate. Knife blade or knife handle, number 3 knife handle. We'll load it with a 10 or 15. You just have to ask your surgeon. Better yet, it'll be on the surgeon's preference card with what blade they want on it. Okay, so the Boyle-Davis gag is our next instrument. This is what we use to keep the mouth open. Think of it as a self-retainer. However, when we use this particular instrumentation, we're using it on the Mayo stand. Why is that important, you ask? Well, you don't want to bump the Mayo. You don't want to do anything. You don't want to lean on it because you can cause the patient to go into a laryngospasm, and you do not want them at all. So when you hand this up, you hand it to them without the blades on, and you kind of guesstimate what size you need. If I was doing a pediatric patient, I'd probably go for a smaller of the blade handles. And if I was doing an adult, I'd probably go larger. So you kind of guesstimate once your patient gets into the room. The next instrument that we're going to talk about is the laryngeal mirror. This is going to be very important because the doctors need to be able to see what's going on. So they use this mirror to do just that, to see what's going on. We have the tongue blade, the wetter tongue blade to just move the tongue out of the way. And the next 2 sets of instruments are going to be your curettes. The first one I'm going to mention is the Barnhill curette wide for adenoids, as well as the Rosenmuller Fossa curettes for the adenoids in the fossa. And it just depends on how big, if they are able to get a lot of the adenoids out with the Barnhill curettes, then that's what they'll use, or they'll ask for the smaller ones. I'll give you a hint as to what the surgeon's going to ask for. Wide curette or thin. But make sure you know the difference. And that is all the instruments in the tonsil and adenoid set. Make sure you go over this because you will have a test.